Okay. I wanted to tell you about my biological dentist. So, other dentist, just a normal, regular, like, dentist. And I don't even know, I think I had asked if anyone knew of, like, a holistic dentist. Because of the demineralization that I was getting. I was like, well, the stuff that they gave me doesn't seem to be working, so what can I use instead? You know, like, how do I help this issue? So, also, like, this has been a while since I was, like, pregnant with Lily. I've had this, like, left TMJ discomfort, and, I thought maybe, like, massage, something like that, you know, would, like, help it. I'm thinking more, like, physical therapy, massage therapy. I'm like, okay, like, universe, send me a referral for, like, a massage therapist to work on this, because it's been bothering me. Again, this is where, like, the ego, like, only knows what it knows. Like, we only know what we know, but yet our higher self, the universe, has so much, like, more vast knowledge of, like, okay, girl, that's not what you need to, like, help this problem. So I go see this functional, or this biological dentist, and he does imaging. So I have something called tori, which is in my mouth. It's like added bone growth on, like, the inside part of my... Alright, I guess you're just gonna force your way over. Sorry, you know, like, when there's, like, cars merging, you usually do, like, 1, 1, 1, 1, 1, 1, like, you take turns. Well, this other truck was just like, I'm gonna go. I could have been, like, you know, trying to force it, but whatever. So I have this added bone growth called tori, and it's from clenching, from grinding, from clenching. I've had it, like, you know, it started, I'm sure, as a kid, and it's just been, like, it's pretty damn big. I didn't even know that it wasn't normal until, like, college, I think, when a boyfriend, like, pointed it out. And then that's kind of when I started learning that I had this. And, like, I've gotten, like, when I was eating M&Ms, like, an M&M, like, stuck under it before. Like, it's got, like, it's like a shelf almost, and there's, like, room under it, too. So my dad also has it. They claim it's not, like, I've read that it's not genetic, but I do think there's some sort of, like, potentially, like, a genetic component to it. And, because my aunt has it too, but my non-biological aunt, my aunt by marriage, my mom's brother's wife, and then my dad. So, my dad, his had gotten really bad where the bone was actually, like, touching in the middle, and he had to have his surgically removed. And I just remember it was, like, super painful, super invasive. They, like, cut the gum, they, like, shave, like, saw off, like, cut off the bone. I was like, oh god, I don't want that. But it's something that I'm like, well, if at some point I need it, then it's something I'm gonna have to consider, right? Well, I also don't, like, think about the fact that there's, like, newer surgical techniques, obviously, since my dad has had the surgery, because it's been years since my dad has had the surgery. So I go and see this biological dentist. Well, it turns out that this stuff that I've been using from asking people for, like, holistic approaches to heal the demineralization, the hydroxyapatite, the some of the stuff has xylitol in it, other stuff does have, like, some oils in it, like peppermint oil is in it, and I have used it in my mouth as, like, a mouthwash, and it seems to be okay. It doesn't seem to, like, cause any issues, because I was, like, worried about that, but it seems to work, without, you know, harming the inside of my mouth, the skin. So I still have a little bit of demineralization, but now it's like in between the teeth. So he told me about this floss that has hydroxyapatite. It's like impregnated with like hydroxyapatite. So I got that floss. And then, Paul Davis, while I'm talking to you, that's pretty cool. Because those seriously did not start popping up until, like, your uncle was starting to not do well. And then it was, like, they started showing up. Oh, and this morning I saw a penguin hair. So, this biologic dentist, I ended up paying to get this, like, 3D, x-ray. So, let me also preface that I have been getting signs for breath work. Like, people have been recommending breathwork classes for me. I've been having videos on Instagram pop up about breathwork. And I do know that plays a role with your pH. And that not getting enough oxygen makes your pH more acidic. So I'm like, okay, do I need to take a breathwork class? Like, I don't know. What do I need to do? So I'm actually taking my friend's breathwork class, like, January 25th. But I also, there's she's a physical therapist, but she's nicknamed herself the Vagina Doc. She's a female health specialist, pelvic health specialist. And she's been posting about these breathwork classes for urinary incontinence. And I was like, oh, well, that sounds neat. Like, and it's still something that I'm considering signing up, but the universe, so all the stuff about breathwork, I get my 3D imaging results back, and it basically shows that because of there's a couple of things, but one of them is because of a decreased maxillary expansion. So, like, the upper jaw didn't expand enough to leave enough room for the lower jaw. That the lower jaw doesn't have enough room to come forward, and it's being pushed back. And when it gets pushed back, it tightens those back muscles, and it occludes, like, the pharynx. So I have a smaller pharynx than, like, what is average normal for, like, proper breathing. So they recommended this certain splint, and he explained it so that it makes sense, that is like a night splint that will touch in the front first. So then what that'll do is it'll block the back teeth from touching, and it'll relax those muscles in the back and the jaw, and it'll prevent the grinding. And I was like, well, that actually makes a lot of sense to me. You know, like, listening to this stuff, luckily I have, like, anatomical knowledge, like, more than just, like, the average person, so this stuff makes more sense to me. He does a really good job, though, I feel like, explaining it in layman's terms. But because I have some anatomical knowledge, I do feel like I probably, like, I do wonder if people would be able to understand it as well. So I'm really grateful for that. And so the TMJ stuff, there's that condyle that comes up. It's straight on the right, but it's starting to get some, like, changes in the anatomy because it's being pushed back. There's not, like, enough room for it. The left one, though, instead of being straight, has actually started to bend and curve. And I'm starting to get some bone spurring, which ultimately I had on my hip, and I did have surgically fixed on my hip. Because I had bone spurring that was rubbing on the labrum and tearing the labrum. And it was like pinching and causing pain. So I had that surgery back in October 2012, something like that, shortly after opening my physical therapy clinic. And I actually had that surgery done in Colorado. Anyways, that's not important. So, but this stuff that's going on the left, now it's like I'm understanding why it's going on the left. And now I'll get a splint to at least prevent any more problems from happening. And then it's funny because he's like talking about like this bone bending and how there's no way to fix that and there's no way for it to, you know, to change. And in my mind I'm going, obviously you've never heard of Joe Dispenza. Like, maybe I should have said that, but I'm not like super like, but maybe I should have said, obviously you haven't heard of Joe Dispenza, because if he can like, through imagery, if he can heal and completely fix a T8 spinal cord sever and paralysis, it's obviously possible to heal that. Do I know exactly how that works through visualization? No, but like we do know that like people that visualize themselves working out and contracting a muscle will have the same muscle growth, if not more, as somebody who is actually doing the physical action. We know that people who visualize the piano and playing the piano without ever touching a key, through visualization practice, can play the piano just like a person who's taught like the physical. So like there's really something to be said about the power of our imagination, which is why things like meditation and guided imagery and all that stuff is so important, right? Like this is like a whole other expansion of like possibilities in healing. Like instead of getting a surgery, this is a really cool video. This is one of these ones that I need to like upload to YouTube. Instead of like getting, I haven't been uploading any videos to YouTube, but like instead of getting a physical surgery, through the power of guided imagery, like guiding somebody through imagining this healing, they could have the same outcome without ever having to be cut open. Like the possibilities are fucking endless. It's so cool. So I understand that. I just haven't grasped that concept, and maybe I would need to practice a lot more, right, in order to grasp that concept. Like Joe Dispenza talks about how he would spend like hours upon hours every day imagining, because he was a chiropractor, so he knew the spine, he knew the anatomy, he was like super knowledgeable, that he would spend hours a day every day after his T8 paralysis from an injury he was like hit when he was on a bike, and he like instantaneously like managed to heal himself. So anyways, like, could the shape of that change eventually? Yes, but at least this will prevent like further degeneration and possible like arthritic, you know, changes if it keeps going the way it's going. And then my tongue, because of the tori is taking up like a ton of my tongue space. So the tongue is like basically starting to occlude the airway, because there's not room for it to sit down in the like valley where it's supposed to sit. So starting with the splint, which is like $650 some, and then they gave me a couple of referrals to an oral surgeon to get this the tori removed, which they said I need to do. But if I get the tori removed and I have the splint, it's not going to just come back. which is cool. Like, if I got the surgery but didn't do the splinting, I'm not changing the origin, the root of the problem, and the tori would just come right back. And again, I'm sure there's a way to like guided imagery, like maybe watching the surgery, if it exists, that I could do that, and I could like heal and actually like disintegrate the tori just through visualization. Like, I'm sure there's a way to do that. I will probably look at getting the surgery. But I figured I'd share that with you. I just find this stuff so fascinating, and it's almost like the demineralization had to happen in order for me to start searching for some sort of like a holistic solution, finding my way to a biological dentist who then figured out why I have left TMJ pain, and now I have a solution to help fix it. Versus in my head, I'm like, PT, massage, you know, and the universe was like, no. But here, we'll take care of this for you, and we'll help you get it. Like, it's really fucking, like, cool. And the demineralization that the one dentist talked about is pretty much gone. And no cavities. So, fucking amazing.